Hi, I'm Dr. Chan here at Crown Dentistry. We get a lot of questions about restorative dentistry, so today I'm going to answer some of the questions that people have on this topic in order to give you a better understanding of restorative dental procedures. Restorative dentistry refers to any number of procedures that we do in the office in order to bring your teeth, your mouth, back to a healthy state after they've been attacked or damaged either through cavities, trauma, or disease. Restorative dentistry and cosmetic dentistry are some of the most common phrases that are thrown about when referring to dentistry nowadays. As we had said before, restorative dentistry is what we do in order to bring the teeth and your mouth back to a healthy state. Any number of procedures can fall under restorative dentistry, such as fillings, crowns, inlays, onlays. Cosmetic dentistry tends to refer to the branch of dentistry where changes are made to the teeth in order to make them look better, bring about a greater aesthetic result, or to just change the way that your teeth look. Our goal here at Crown Dentistry is to make the experience of coming to the dentist as comfortable as possible. A lot of people don't like coming to the dentist either because they're scared or because they think things are going to hurt. One of the ways that we make things better for our patients is to offer anesthesia, both local, which means injections or shots, or through sedation. We offer nitrous oxide, also known as laughing gas, or we also offer oral conscious sedation. Oral conscious sedation is done also using nitrous, but in addition, we'll use some medication that we'll give to the patient either before the appointment or during, or sometimes both. This medication serves to relax the patient and also allow you to forget a lot of what we're doing during the dental procedure. A lot of times people will remember coming into our office and then they'll remember being at home. That's the magic of oral conscious sedation. So some of the benefits of restorative dentistry can be either bringing your teeth back to a healthy state or also making them look better. I always believe that healthy teeth that feel good are also the teeth that look good. So here at Crown Dentistry, we believe that restorative dentistry done well, correctly, and with care can also double as cosmetic dentistry. We believe that if teeth are healthy and happy and the patient is pain-free and able to eat, speak, and just live their life, a lot of times that is the best cosmetic dentistry. So you have to think of a filling as a way to restore the tooth either after there's been a cavity or some kind of trauma, like maybe they fell and cracked their tooth on a door or a bench, or sometimes fillings are just done to slightly change the shape of the tooth. Filling material is basically a very advanced, very strong form of plastic that we glue onto your teeth. You have to think of a crown as a hat for your tooth. A lot of times teeth are damaged beyond what can be saved or fixed with a filling. In those cases, we turn to the use of crowns. Say somebody bit on a nut or something hard and cracked half of their tooth away. It wouldn't be good for the long-term health of the tooth in order to put a big filling there. In those cases, we'll usually put a crown or a partial crown, otherwise known as an onlay. Inlays or onlays are basically partial crowns. For example, a full coverage crown is one that will cover almost all or all of the tooth. A partial crown is one that will cover a part of the tooth. Sometimes if we are able to save a part of the tooth and use that in our restoration, it's better for the tooth long term. Sometimes either because of large fillings, large cavities, or trauma, for example, like a part of the tooth broke away, the nerve of the tooth is exposed. Normally, the nerve of the tooth is protected by a covering of a strong, healthy tooth. But sometimes fillings or cavities or some kind of trauma will eat their way or break their way into the middle of the tooth, exposing the nerve and the blood supply. In those cases, a root canal may be needed in order to clean out that infection and clean out the exposed nerve and blood supply. Sometimes teeth fall out. Sometimes teeth get broken to a point where they can't be saved. In those cases, teeth may need to be extracted or removed. That would leave a big hole in the patient's mouth, which is obviously not ideal. So one of the ways that we can fix this is by giving the patient a bridge. A bridge is exactly what it sounds like. It's basically closing the gap between two teeth. One of the ways that a bridge will help the patient is that it will protect the teeth on either side of the gap and also include a tooth in the place where the tooth was previously missing. So a bridge is needed when there's a missing tooth. Sometimes a tooth has been gone from someone's mouth for a long time. Sometimes there may be trauma or large cavities which require the tooth to be extracted because there are just some things that we can't save. In those cases, a bridge is one of the options that we use in order to give the patient a new tooth. The way that bridges work is that we put a crown on each side of the gap, connect them to a false tooth or teeth in the missing gap. After a bridge is cemented in the mouth, a patient has new teeth. Dental implants are an exciting new field in dentistry. What they do is that they allow us to give the patient a standalone tooth where a tooth was previously extracted or just missing. One of the advantages of a dental implant is that we don't have to involve the teeth on either side of the missing space. An implant can be placed and the patient will have a new tooth in that gap. Dentures are another option that patients can use in order to replace missing teeth. Sometimes a patient's teeth will be so covered with cavities and or broken portions that they can't be saved. In those cases, these teeth may need to be extracted. There are two main kinds of dentures: full dentures, which replace all the teeth in either the bottom or the top arches, or partial dentures, which replace some of the teeth in either the top or bottom arch. Full dentures are used to replace all the teeth on the top or all the teeth on the bottom. Those dentures are either held in place by suction or implants. Partial dentures will replace some of the teeth in either the top or bottom arch. Those partial dentures will then be attached and be supported by some of the existing teeth that are still in that arch. There are always risks associated with any procedure that we do here in the office. Thankfully, here at Crown Dentistry, we find that our success rate with restorative dental procedures is very high. Recovering from restorative dental procedures depends on the size and extent of the dental procedure. For example, a patient who has a filling done on one tooth will probably be good to go in a couple hours, and they'll be able to go back to work or back to home. Sometimes certain procedures may be a little bit more extensive and may require more recovery time. Some of the experiences and procedures that require a little bit more recovery time are extractions, implants, or multiple units of crowns and or a bridge. A big portion of the success rate for restorative dental procedures depends on you as the patient. We do our best here at Crown Dentistry to give our patients good post-operative instructions, what to do, what not to do, how to take care of their teeth. We find that when patients follow these guidelines, their success rate and post-operative recovery times tend to be much improved. Our friendly and knowledgeable dental staff are waiting to help you schedule an appointment so that we can begin the journey of bringing you back to optimal dental health. I hope we've been able to answer some of your questions on restorative dental procedures. But if you have any additional questions, or if you're ready to take action, please give our office a call at 916-285-9678, or you can go to our website at www.crowndentistry.net. We're here to help.